Hello, good morning, everybody. Today the topic of the lecture is neuroophthalmology, and this is a very important lecture because it actually combines neurology and also ophthalmology. Okay, all right, let's start. So, as a primary care physician, you must be able to perform basic neuroophthalmic examinations, and you must also be able to recognize and interpret the common sign and symptom of neuroophthalmic disorders. Okay, so there are a few objectives. You must be able to measure the visual acuity. You must be able to examine the pupillary reactions, like from the previous lecture. And in this lecture, you're going to learn how to examine the extraocular movement, visual fields, and also how to examine the optic nerve head. Okay. So, do you know that 65% of intracranial diseases exhibit neuroophthalmic signs and symptoms? Okay, and for example, do you know that patient with neurological problem can actually come to the eye clinic instead? Okay, they can actually have, for example, people with brain tumors, they can come with visual field defect. People with multiple sclerosis, they can come with optic neuritis, and then people with stroke, they can come with visual field defect also, and so on. Okay, all right. So there are two terms that we use in this lecture, which is first is the true localizing sign, and the other one is false localizing sign. Okay, true localizing sign is, for example, the visual field defect of bitemporal hemianopia. It is caused by the lesion in the optic chiasm. So, because of the pituitary tumor comprising the optic chiasm, it causes bitemporal hemianopia. However, in false localizing sign, patient actually presented with double vision because of the sixth nerve palsy. And then when you look at the fundus, the optic disc is swollen. And in this thing, actually, because of high ICP, secondary to probably brain tumor or hydrocephalus. Okay, so the sixth nerve palsy is actually a false localizing sign. Okay, it's the sixth nerve palsy is not a palsy because of tumor comprising at the sixth nerve pathway. It is a different thing. The problem is from a different place, giving rise to a different problem. So it's called false localizing sign. Okay, so there are a lot of other examples that you can find on the internet if you're interested. Okay, next we go to neuromotility disorders. The commonly term that we use is diplopia. And as a medical doctor, you must be able to distinguish that the diplopia is a true diplopia. True diplopia means it only happens with two eyes, but when you cover one eye, the diplopia disappears. Okay, but if you covered one eye, the diplopia is still there, meaning that it's not a true diplopia. Okay, that is probably because of problem with the media, problem with the cornea, problem with the lens, cataract, or refractive error. So if it's not a true diplopia, you can always refer the patient to for refraction. All right. For true diplopia, all you need to do is just to help the patient to be able to walk, you just need to cover the abnormal eye. So after that, patient will be happy. Oh, now I can walk better. All right, but you have to distinguish what is the causes. All right. Okay, we will continue after this.